The role of the primary care team and public health nursing is to enable older persons to stay at home and to live at home for as long as possible. We have an ageing population, and some of that population develop complex care needs. So the community virtual ward was developed to support health practitioners to prioritise care, to identify patients at risk of hospital admission or deteriorating conditions. Patients, while they remain at home, will now receive assessment by a clinical case manager where decisions can be made in a timely way and care provided.
So I'm going to see a 88-year-old lady who she was originally admitted to the Red Virtual Ward following an event, and she progressed quite nicely through to the Green, and she was kept out of hospital, but unfortunately she had a fall, and as a result she's now being readmitted back into the Red. So it's just closer monitoring for her, and also support for her daughter. There are 3 virtual wards: Red, which is high risk, Amber, which is moderate risk, and Green, which is low risk. And types of service interventions and monitoring depend on which virtual ward the person is admitted to. Individuals can move in and out of the virtual wards depending on the response to service interventions.
Hi,
Hey
Claire.
Carol, how are you?
Good.
Good.
To see you.
How's things been?
Up and down. Good days, bad days.
Okay,
You know.
okay.
But I'm glad you're here anyhow.
I know, yeah.
Just ask a few questions if you don't mind. Hi, Mum. Claire's here.
Hi.
Hi, Claire.
How are you doing?
Not too bad.
How have you been since the fall? How's the pain in the shoulder?
It's still there.
It's still there.
But it's not as bad.
It's not as severe.
And on the Zimmer frame now, she's walking on the Zimmer.
We're back
now?
onto the Zimmer frame after we had an appointment there on Thursday. I went back to see the fracture clinic.
Yeah.
I know my mum's quirky ways. I know the hospital service wouldn't be able to provide that. I'm confident when I'm having the medical support that I know, and I'm only a phone call away from getting the assistance and guidance I need. Down to the simple things as well as having to change my household to run and try and visit mum in the hospital within predictable hours. And when you have them at home and you have the support, there's no reason not to keep the elderly at home. It's much nicer for them.
Major benefits of this initiative is that people have changed the way they work. They've changed the model of care to provide more person-centred, patient-focused care. And this has obviously had a huge impact on ED admissions, bed day admissions and hospital avoidances.
It's just really rewarding to see that you can be patient-centred and patient-focused, and you don't need a lot of money to do it. It's just being more creative within the resources that you have.